Scene is safe, utilising PPE for standard precautions, which is gloves and protective eyewear. I'm going to explain the procedure to the patient and gain consent. Hi, my name's Lucy. How are you?
Good, thank you.
What is your name?
Daniel Hardy.
Daniel, do you mind if I do a respiratory assessment on you tonight?
No, that's fine.
No worries. Okay, so now what I'm going to look at is the patient's breathing. Patient seems to be in a right rate. The rhythm of his breathing seems to be normal, and the quality seems to be normal. Patient is not in a tripod position and is in a position of comfort, which is sitting upright. The patient is able to speak in full sentences, as he told me his name. Patient doesn't seem to have any CO2 retention. I can see no clubbing in his fingers and no hand flap or no pursed lips. Patient's skin is warm to touch and patient's skin is pink. Patient doesn't seem to be on Homo 2, as I cannot see it. Are you on any medications?
No.
Never been on any medications?
No.
Patient isn't on any medications, which includes any respiratory medications like salbutamol. Okay, so have you had a cough as of late?
Nope.
Not in the last month?
No.
Haven't been sick with the flu?
No.
Have you been bringing any sputum up?
No, no phlegm.
Not at all? Good.
No.
Okay, so what I'm going to do now is expose your chest. And I'm going to just count your respiratory rate. Patient seems to be breathing at about 16 rates a minute. Okay, so patient's chest seems to be normal. The rise and fall seems to be normal. And now I'm going to visualise for any bruises or scarring or wounds or pacemaker. So I can't see that the patient has any scarring, no bruising or wounds, and he doesn't seem to have a pacemaker. Okay, so now what I'm going to do is palpate the patient's chest. Any pain?
No.
Not sore through there? Through there?
No.
Sore under here?
No.
Any pain in your back when you breathe in?
No.
No. Patient has denied any pain through the chest on palpitation. So now I'm going to percuss. All good?
That's good.
And now I'm going to have a listen. Breathe normally. Everything seems to be normal. I can't hear any noises, no wheezes, crackles or ronky. I can hear that there's normal lung sounds in those fields. So at this time, I'm going to just explain to the patient my findings. Everything seems to be fine tonight, sir. So
Thank God.
what I'm going to do is not transport you tonight. So I'm going to TNR this patient.